Diagnoses of depression, anxiety, or cluster B personality disorders, particularly borderline personality disorder, is a risk factor for engaging in non-suicidal self-injury. But just because someone self-injures does not mean that they have borderline personality disorder or even features of borderline personality disorder. In fact, one study of adolescents looked at NSSI disorder, which is a proposed diagnosis for further study in the DSM-5, and they found that the overlap between NSSI disorder and borderline personality disorder was not significantly greater than the overlap of other diagnoses in borderline personality disorder. For instance, 52% of adolescents who met criteria for NSSI disorder also met criteria for borderline personality disorder. But 52% of those who met criteria for a mood disorder also met criteria for borderline personality disorder, and 48% who met criteria for an anxiety disorder also met criteria for borderline personality disorder. Yet we don't say that someone who has depression or anxiety has features of borderline personality disorder, even though adolescents with borderline personality disorder have significantly greater odds of being diagnosed with NSSI disorder than those without borderline personality disorder. They have even greater odds of being diagnosed with a mood or anxiety disorder.